Hi, I'm Dr. Derek Sweet, and it's my pleasure to meet with you today to discuss sleep and recovery. You know, as a sports psychiatrist, as someone who handles behavior and sleep for teams, it's always a challenge to get folks to understand the importance of sleep. And even if you get them to understand the importance of sleep, it's difficult to get folks to apply sleep as a part of a recovery program and to give it a formal place within recovery and to track it and monitor it, because that's what it takes in order to really make sleep a critical and important part of any recovery program. It has to be conscious. We have to be aware that we want it to be a part of what we do, and then we have to track it and put the kinds of programs and guidelines in place for our athletes so that they can understand it. It's not good enough just to say get some sleep or you should get 7 hours sleep, because everybody kind of knows that. It's really about educating and increasing awareness and then finding practical ways to show and demonstrate how that should be done. So today, what I'm hoping to do is talk to you a little bit about sleep and why sleep is important to recovery. Now, we all know that recovery is the restoring or the restoration of something that was either taken or lost back to its baseline, or perhaps even better than it was before. And that's certainly true of sleep. Sleep is purported to be a major reason that we recover. And certainly the literature suggests that, the scientific literature suggests that. However, I have to tell you, it's not clear in the scientific literature that sleep actually does create recovery. We can infer it and deduce it and induce it, but there's no literature that I can give you or point you to that would tell you definitively that sleep is causing or leading to this recovery. The current thinking in science and sleep science is that sleep might be part of a meta-regulation process that actually supports something called adaptive awakening or an adaptive wake state. Now, that's a bit abstruse, but it's important to keep in mind that there's no hard evidence that is locked down, steadfast, that sleep is actually creating recovery. That said, it's the best explanation we have for recovery, including using nutrition and other kinds of modalities. Sleep is really thought to be linked and certainly important to recovery processes. So with that sort of weird philosophical introduction, I'll get right down to sleep and why it's important to recovery as far as we know from the science that we have. So one thing to keep in mind is that sleep is a behavior. It's not just rest, right? It's more than rest. Sleep is a lot more than rest. Sleep is a physiological phenomenon that all mammals or most mammals participate in, and it really gives the body and the brain a chance to power down and to rest a bit so that it can be replenished and reloaded to perform waking activities. So the important point here is that sleep is a behavior. Now, the thing about the idea of it being a behavior is this, that it can have periods of activity that are like the wake state. So sleep has two phases that we need to think about when we think about recovery. And you know this already. There's non-REM sleep, and then there's REM sleep. And that in non-REM sleep, we know that there is evidence that we have human growth hormone, we have testosterone, and other kinds of hormones and neurotransmitters secreted that really help with deep rest and muscle recovery and muscle repair and bone growth and those sorts of physical sorts of recovery modalities that are important for physical activity and reaction time and coordination, those sorts of things. Now, with REM sleep, which is another type of sleep. That's what we call the dream sleep. This is where we see more mental recovery happening, so that the mind and the body are rejuvenated during sleep, and non-REM loosely handling physical recovery, and REM handling loosely mental recovery, learning, cognition, that sort of thing. Now, what's really important to understand is that sleep also cycles. You have 4 or 5 90-minute cycles during the night of non-REM and REM sleep. Both non-REM and REM sleep are needed in order to have a really good night's sleep, quality sleep, and also restorative sleep. So if you look at a sleep cycle graph, what you will notice is that towards the end of the sleep cycle, towards as you go across, as time passes, the REM sleep becomes more and more prominent. So towards the latter half of the night is where you're going to get REM sleep. And that REM sleep is your mental restoration sleep, your cognitive recovery sleep. And it's really important that you get that, because if you don't, you can have some physical recovery, which is non-REM at the first part of the night, but then you didn't get your last 3 or 4 hours of sleep. And boy, what you have there is now a situation where you might be physically restored, but not mentally fresh. And we've all been in that situation, haven't we, where we've kind of felt like we didn't get enough sleep. We're physically kind of moving around, but mentally we're not where we should be. So that's why we need 7 hours of sleep or 8 hours of sleep. And in terms of athletes who spend more calories and who are doing a lot more work, they end up needing a whole lot more sleep. And in fact, they probably should get more, especially during training camp and when they're doing really intensive work. They will, just as they might need more calories for energy, they would need more sleep for restoration and recovery. Again, non-REM sleep, physical recovery; REM sleep, mental recovery, loosely. Okay, so with that said, let's talk about the heart and the brain, two big organ systems that every athlete needs and we all need, right? So the brain is really important because, hey, that's where our CNS nervous system, that's the central nervous system, right? And so what's important about that is that it's the command center of the entire body, right? All physical activity and mental activity, interestingly, is coordinated by the brain. And sleep, it turns out, is really important to the brain's recovery. It used to be that we didn't think the brain had a lymphatic system of any kind, and it didn't really detox itself or purify itself. Now we understand that there is indeed a glial cell system that's called the glymphatic system that actually cleanses the brain. And guess when it does it? During sleep. So the brain detoxes and cleanses itself during the sleep. So that's important to know. The brain replenishes itself, it repairs itself during sleep. Plasticity in the brain's ability to generate neurons and do the kinds of repairs that I just mentioned, that's a critical function of sleep. The behavior of sleep is really good for the brain. And this has implications, right? Because if the brain is functioning well anatomically and physiologically, well, then what happens is then your muscle coordination is going to be okay, your thinking is going to be pretty good, your reaction time is going to be pretty good, your fine motor skills are going to be pretty good. So many physical and mental processes are going to be aligned because you're sleeping or getting the right amount of sleep. So getting that 7 to 8 hours of sleep is critical for the brain so that it can regenerate, repair, and reload itself. So to help us with physical activity and recovery. That makes a lot of sense. The brain is important because it sets up the release of neurotransmitters and hormones that are important to the body's function. And these hormones and neurotransmitters, well, these neurotransmitters, which are from the brain, and the hormones from the body, they work in concert with each other to regulate muscle growth, muscle repair, to help protect from injuries. So, for example, growth hormone affecting things like insulin growth factor 1, for example, or maybe it's just a release of maybe something like getting testosterone released in the body or growth hormone released in the body. These are important transmitters and hormones that help the body repair itself, help the body gird itself for action, and helps the body stay vibrant and strong. Transitioning into the autonomic nervous system, which, as you remember, from your sympathetic and parasympathetic nervous system, that too is under sleep's regulation, or at least concomitantly works alongside your sleep to help your heart feel regenerated. And so that's why we tell athletes that they have to sleep, is because obviously we need our heart and our cardiovascular system to get oxygen-rich blood throughout the entire body. And if the heart doesn't recover, well, then we may not have the strength and the power to really do the work that we need. So what's important to know is that sleep does have a connection to the autonomic reactivity of the body. And so in non-REM sleep, for example, there is more vagal tone. And this is why you end up having sort of a different kind of a lower heart rate during this period. And that's why you have more rest, because the parasympathetic nervous system is really operating heavily during the non-REM sleep cycle. Whereas in REM, you have a loss of the vagal tone and more sympathetic tone. And that's why during REM, you'll find that there's a greater degree of heart rate and a greater degree of almost waking-like activity. Now, interestingly, people who have heart attacks or MIs, they lose that vagal tone in non-REM sleep, and that can create a problem. And so it's something that we should always keep in mind, is that the heart and the nervous system are linked, so that you can determine to some degree somebody's ability or readiness to recover from exercise, I should say, based on their resting heart rate, for example, and their heart rate variability. So that's like a hot thing right now, heart rate variability, being able to look at RR intervals and look at the automaticity of the heart and how it sort of varies from beat to beat, and loosely thinking that if somebody has a resting heart rate that's lower and they have a HRV, or heart rate variability, that's a bit higher, that profile portends that they're recovering and adapting and coping well with a certain amount of stress, like physical stress, for example, and that if you have increased heart rate and an increased HRV, or decreased heart rate and decreased HRV, you can begin to wonder whether or not there's accumulated fatigue going on in the body. And so lots of folks are now kind of using resting heart rate and HRV to determine readiness and recovery. And so that's important, because sleep is cardioprotective. And it does help to have had a good night's sleep, and you can monitor what the heart does all night long with the right kinds of instruments. And now there are all these things like Oura rings. I'm actually wearing one, the Oura rings, and other kinds of Fitbit watches, and even index finger thermoregulatory devices that can tell about your state of readiness, looking at heart rate and looking at resting heart rate and heart rate variability. So sleep helps the brain and it helps the heart. The other part that's also important for recovery is to understand inflammation. We all know that inflammation is this huge pathway through which so many diseases, infectious diseases, inflammatory diseases can sort of fester and create issues and even affect performance. And so sleep actually affects the immune system. It turns out that natural killer cells and other kinds of immune cells are tanked up and strengthened during sleep. And so if we don't get sleep, we can actually end up with immune dysfunction. So that's another huge system that could be affected by sleep. And with immune dysfunction, we're more susceptible to infection, we're more susceptible to illness, and we're more susceptible to injury. So that's another reason that we need to sleep, and really push athletes to sleep as much as possible. And by as much as possible, I'll have to say that we're looking at a minimum of 7 hours a night. Now, I would like to take a break from the science for a moment and just talk to you about what makes it hard for the athletes that I've worked with to sleep. I think I'd like to say generally there are two ways to look at this. In the general population, we are all worried about light. We now know that blue light, for example, is a reason why we don't sleep, right? So blue light's it's like the enemy of sleep. And as a world, New York City, where we are right now, it's tough. Light is everywhere, and that's what causes us, our suprachiasmatic nucleus in the brain, to get stimulated and off we are to being awake and having more cortisol in our body. And cortisol is not a good thing. It's a good thing when it's needed, but not a good thing when it's not needed. And so we do definitely want to reduce light, blue light. That's one thing we face in society. And then the other thing we face are those mobile devices. Electronic devices and light together are like double light for the world. Now, athletes live in that larger context, right, of this world having like way too much light at night when we should be sleeping. But athletes also have a different set of risk factors, right, for having difficulty sleeping. And those risk factors include the fact that they have competitive anxiety all the time. They actually have competition. So that really can raise adrenaline and epinephrine and other kinds of stimulatory hormones and neurotransmitters in the brain. And that's happening at night, right? So when most people are winding down, they may have late games and they're winding up. That's an issue. And it's hard to come down after that. Then there's travel and crossing time zones, and of course, all of what jet lag brings with it. And that's a whole other discussion, how to handle jet lag. One of the things that we do with the team is that we actually try to predict which time zones we're crossing and try to have a plan for what time should practice be. What should we do before we get on the plane? When do we wear our blue blocker glasses? That kind of thing. How do we advance our body clock? That kind of thing, right? So athletes have the problem with competitive stress, late night games. They have this whole problem, right, with travel because they're always traveling or crossing time zones. Then they have stakeholder demands, right? Everybody's asking to do something at some point in time. Another thing that sometimes happens with athletes is they have these early morning trainings or early morning workouts. And depending on what the team culture, they could be up really early. Swimmers are notorious for having two practices, one super early in the morning and another one way later. And so it depends. Sometimes having early practices versus your off day when you want to sleep a little bit more. And now, all of sleep hygiene talks about waking up at the same time every day. But if you're not doing that, then your sleep cycles are off. So let me just review what I just said, right? So there are two types of risk factors. There's the general risk factors for like sleep deprivation, which are light and the idea of electronic devices. That's the big world. And then superimposed on that, the athletic sort of culture and lifestyle, which involves competitive stress, which involves early morning trainings and dysregulation of their sleep-wake cycle, and then the competitive late night performances that throw them off, and then the travel. So again, those things will actually affect sleep, which will affect the central nervous system that I talked to you about before, affect the cardiovascular system, as I spoke to you about before, with the resting heart rate and the HRV, and then it also affects the immune system, right? And the inflammatory cytokines being privileged when they shouldn't be, and that kind of thing. But more cortisol around, you could see where this could lead to a kind of a proteolytic environment that creates muscle degradation and injury risk, right? And so that's why we want to regulate sleep. That's why we want to regulate travel. That's why we want to intervene with athletes and help them get the rest that they deserve, because we don't want them to have these outcomes, cardiac outcomes, CNS outcomes, and immune outcomes that actually affect performance. And I'll tell you, and I haven't even mentioned cognitive or mental performance yet, because that, of course, with low REM sleep, as we talked about, you will find that people are less likely to remember the plays. Remember that you have to have REM sleep in order to remember, to learn, to encode. Hippocampal connections in the brain are super important, that they be rested and regenerated so that we can actually encode and learn and memorize information. So if somebody's having trouble with their playbook or remembering a play or knowing what to do in the final minutes of a game, that could be a reflection of a lack of sleep, because judgment and decision-making are all part of the cognitive recovery piece that is found during REM sleep. Some non-REM too, but mostly REM. Okay, so wow, we've covered quite a bit, and I know that I only have about 15 minutes, but I wanted to make an argument for you so that you could see why the brain, the heart, the immune system, the musculoskeletal system, and the cognitive system are all affected by sleep. And if you don't have somebody who's recovered and they're doing everything else right, their nutrition is right and all of that, and they're getting the ice baths and all these other things, If you're not sleeping, these major systems are not going to be at their optimum. And just to prove it, there are studies out there where they have studied swimmers, for example, and volleyball players, and even basketball players. And the Stanford basketball study is a good example of that, where they extended the sleep to about 9 hours, 9 to 10 hours for the collegiate athletes at Stanford. And what they found was like a significant increase in their free throw shooting percentage, their field goal percentage, as well as even their sprint times, okay, their court sprint times were all elevated. So that's important. And because I'm into mental health, all of the athletes, or the majority of them in that study, from what I read, they all reported a sense of greater well-being, a sense of feeling more physically well and more mentally well and emotionally well. And that's really important, right? That's as much a part of recovery than anything else. That sometimes that extra competitive edge that you need is really because you've been getting the kind of sleep that you need. Let me say a quick word about medications and sleep, right? So often I'm asked to prescribe medications for sleep, and that's a big deal. What we try to do is try to stay away from medications as much as possible, right? I think the first thing is to always look at sleep hygiene. Sleep is complex. Remember at the beginning of this, I said that sleep may not even be directly linked to recovery based on some of the research that I've read. But, it's interesting. We do need sleep, because if we don't get it, we end up with sleep deprivation, and that's almost like being drunk. People have car accidents, they have all kinds of issues. So people do come and ask for like help with their sleep when they're not feeling recovered. So that's an area that we have to look at. And what I would caution everyone about is with sleep medications, and this is a whole other talk, but sleep medications are really dangerous if you don't know what you're doing, right? So because some sleep medications suppress REM sleep and some suppress non-REM sleep. Some suppress both. And sometimes we have to understand the difference between being a sledgehammer sedated and actually sleeping. Because remember, we said sleep is a behavior with all of these restorative processes. So you need your non-REM sleep and you need your REM sleep in order to actually get restoration and replenishment of certain kinds of processes in the body. So we should not be suppressing them. So it's really important to know which medicines do what and to use them short term. I'll also say that if you go into the literature and read on sleep medications, chronic use of sleep medications has been linked to decreased longevity and a decreased lifespan. So that's something to just keep in the back of the mind, not a side effect people actually talk about, but it's there. And I think erring on the side of using sleep hygiene, the kinds of things that I'm sure everybody here knows, right? Keep the room dark, keep it cool, right? Keep the temperature down. You need a drop in core temperature actually to even enter into REM sleep, right? It's important to drop that temperature to a low number so that we can actually induce the kind of sleep that we need. Obviously, you want to have for athletes in particular, having a wind down routine is really important, right? You've got to wind down that hour or two before sleep and start wearing the blue blocker glasses, cutting down on blue light, putting filters on the phone. And we advise athletes not to get into stressful conversations or do stressful things the hour or two before bed. So a lot of the work I do is also spending time with the pre-bed routine, getting folks into a bed routine and understanding that the bed is really for sleep and sex and nothing else, right? And never watch TV from bed, never use your phone from bed, all because again, that blue light is nothing but a stimulation and it sends the message that we should be awake. We always tell people from a sleep hygiene perspective, hey, if you're not sleepy, don't go to bed, right? Find something to read in low light or something, or do some deep breathing. Let's do some relaxation, some mindfulness techniques. We don't have the time, but there's all kinds of sound therapy. There are all kinds of light therapy, red light specifically, and brown noise, as well as pink noise and other kinds of noises that can be very helpful with sleep. Certain aromas that can be very helpful with sleep, including lavender, sandalwood, and other kinds of aromas are important with sleep. Now, avoiding nicotine, caffeine, and alcohol are no-brainers, and everybody kind of knows that. Also important to also not have sugar, right? Refined sugars just before bed, because any spike in blood sugar could actually affect sleep as well. From a sleep hygiene perspective, I'd like to say one last word about naps. Naps are probably not a good idea to do unless you absolutely need it. If you do need it, you should take it. And when you do take it before 3 p.m. if you're an athlete. What you don't want to do is sleep past 60 minutes because then you can have this sort of inertia, this sort of lethargy when you wake up because you might go too deep into your sleep cycle and you don't want to wake up in a stage 3 or in the deep parts of sleep because you'll be groggy for the game. So naps should be limited to 60 minutes or less as needed and before 3 p.m., certainly well before game time. So I'm going to stop here, and I hope this was at least helpful and got you interested in thinking about sleep as an important part of your recovery programs, and that you would ask athletes about their sleep. And because the other thing I'll tell you, in the psychiatric literature, it's clear that athletes underestimate sleep. We all do. We all underestimate how well we sleep or how much sleep we're getting and how rested we are. So given that sleep is so critical to health, so important to preventing illness, preventing injury, so important to competitive play, and the fact that athletes do underestimate their sleep, we kind of all do, it does make sense for us to try to allow sleep to be a much bigger part of our recovery program and certainly increase awareness about it. I'm going to stop here. I'm Dr. Derek Sweet. I thank you for your time and look forward to catching up with meeting with you all at some point. Take care.